I'm riding with the San Francisco Fire Department right now, part of a new unit that responds to opioid overdose calls. There were more opioid overdoses in San Francisco than COVID deaths in 2020. This unit's meant not just to save lives, but to stop this from happening again. The city of San Francisco has been hit so hard by overdose deaths, it now has a new unit devoted to harm reduction. I rode along with Captain Mike Mason of the fire department and Kevin Lagore, a nurse practitioner.
This is our guy.
We arrived at this stop just after a man had been revived with Narcan, the antidote to fentanyl. We've only been out here with the fire department for about 10 minutes. This is already the second call out of the day for overdose. They say it goes nonstop.
Medic one.
The calls came one after another, after another. And for the men and women who do this work, the toll can be exacting. It must wear on you.
We've had some very long, very sad days.
There's more inequality here in California than anywhere else in the United States. If that wasn't the case here, do you think it'd be easier to get people away from using drugs like this?
The drug overdose epidemic in San Francisco does mirror intense social and health inequalities. 5% of San Franciscans' populations are black individuals, yet 25% of overdose deaths include people of color. Less than 1% of San Franciscans people are individuals here are unhoused, but they comprise approximately 30% of overdose deaths.
How often? I spoke with a homeless married couple outside a clinic who said they were fentanyl users. When did you guys first see the fentanyl in California?
Since last summer.
How cheap is it?
Way cheap.
$5 will take care of us for a whole day.
For a day,
yeah,
$5.
It's like a quarter of the cost of heroin.
We're in the Haight-Ashbury.
University of California medical school professor Dan Ciccarone says the fact that drugs are cheaper, more plentiful, and deadlier than ever means America should rethink drug policies.
We would love to know that we can put the fentanyl genie back in the bottle, right? It's probably not going to happen.
What about policies that have nothing to do with drugs explicitly, but the underlying conditions?
What are we going to do that's outrageously new, creative, bold, in terms of addressing those root issues, the issues of inequality in America, the roots of racism, of desperation?
This is in the Fillmore district.
Back on the road with the response unit, our last call of the day was also for someone just revived by Narcan. He said he was a veteran and asked to be transported to a nearby veterans hospital.
Yeah, it's a clinic.
Afterward, I spoke with Starnisha Bryant, a healthcare worker in a nearby office, who revived him.
He said he's ODing, so I took my Narcan off, stuck it up his nose.
They're going to follow up on the work you did and try to get him into a treatment program.
Hopefully it works, but you gotta want it.
You got to want it.
You gotta want it.
What do you see? Do people want it these days?
No.
Why do you think things are as bad as they are today?
It's easy to get it. You can come to any corner and get it.
Incredible. Jacob Soboroff with us live now. Why is it so easy to get it?
Well, because it's so easy to make, Shep. Unlike heroin, it's not made from a poppy plant. And because that poppy plant was very difficult to cultivate, now it's made in a lab. And now that it's made in this lab, ultimately, it's going to be spread all throughout Southern California, all throughout the nation, all throughout Northern California. And that's why they're focused on inequality, not necessarily stopping people from dying.
Great report. Jacob Soboroff, live in the back hall. Thank you.